So to get started with Invisalign, we start out taking some photos, taking a scan of your teeth. We also take some x-rays, make sure that there aren't any cavities going on that we would like to take care of first. We don't want to neglect any cavities or other dental care that has to be done before starting with the Invisalign treatment. So we'll take photos, a scan, and x-rays. We'll send everything out to Invisalign, and we get a report back in a few days from them. It will give us a treatment plan of what to expect, how your treatment will look, how your results will look, and I share it with you and we can discuss the plan. It's all visible online and we both have access to it. Once you're happy with the treatment and the results, I go ahead, hit approve, and we get the trays mailed to us in about 2 weeks. And then you'll start coming in for your appointments. Appointments are pretty short, usually about 15-minute appointments. There are some attachments that we place on certain teeth depending on each case. It's all individualized. And so that one appointment where I have to place the attachments, they are tooth colored like filling material that sort of resembles brackets and helps us push teeth a certain way or in a certain direction. So that appointment would be a little longer, maybe half an hour, but really short appointments, a lot of check-ins that we do with you to make sure that treatment is going according to plan, and not a lot of chair time.